Hello, Po. I'm Doc Jetlin. Yes, Doc. You're Nitya, right? Yes, Doc. And you're 45 years old. Yes, Doc. And what is your religion? Roman Catholic, Doc. Okay. And what do you do for living? I am a graphic designer, Po. And are you married? Yes, Po. And do you have any children? Yeah, I have one daughter. Okay. And when is your birthday? My birthday is August 9, 1977. Okay. From where are you originally? Doc, I am born and raised in Bagut, Abra. Now I'll be asking you some questions and will be writing it on the paper to record. Are you okay with this, Po? Yes, Doc. So, what brings you here today? Doc, I had experienced seizure while talking to my co-worker in our office, Po. Okay. Did you have any history of seizure before? No, Doc. Okay. Can you recollect your experience before? No, Doc. Okay. Were you aware of this event? No, Doc. I was still confused for 20 minutes after that. Okay. Whom are you talking at that time? May I ask who she is? My co-worker, Doc. And she is waiting outside. May I ask her some questions? Yes, Doc. Okay. Good morning, ma'am. May I know your name and your relation with Nitya?
I'm Ardra, Doc, and I am the co-worker, and she was talking to me when she was having the seizure.
Okay. I'll be asking you some questions for what you can remember. Is it okay with you?
Yes, Doc.
Okay. I want to ask about what happened before, during, and after the episode.
Yes, Doc. Nitya and I were talking when she suddenly turned her head towards the right.
Did you observe any unusual with her when you were talking and any facial expression from her before the event happened?
None, Doc.
Okay, that's right. How long did the seizure last?
It lasted around 2 to 3 minutes, Doc.
Okay, but after the episode, what is the state of Nitya?
I'm asking her whether she's okay, but it seems like she cannot process what I am saying, so we let her rest for around 20 to 30 minutes.
Okay, for the past days, did you observe any differences like behavior or mood changes?
No, Doc.
That's right. Okay, thank you. Now, Miss Nitya, I want to ask you if there are any problems you encounter either from home or work from the past months.
Well, for the past 2 months, I wanted to be separated and away from my husband.
What do you do when these feelings hit you?
I resort to drinking 1 glass of wine a day, Doc.
Okay. When was the last time you seek for a doctor?
This is the first time in years, Doc.
Are you on any medications?
No, Doc.
Oh, this may be sensitive, but do you take drugs?
No, Doc.
Okay. Do you or did any in your family have long time health problems?
Both my parents have hypertension, Doc.
Okay. Do you have any allergies?
No, Doc.
The patient is relaxed and comfortable while sitting. She is appropriately well dressed and groomed. She is friendly, cooperative, and maintains a good eye contact. Patient is fluent with a continuous flow of speech but with a poor articulation and responds appropriately to questions when asked. Patient is relaxed, exudes appropriate affect with his responses and not emotionally labile. Do you see things that I might interpret differently?
None.
Do you see things that I might not see or hear?
No.
Do you have any persistent belief that other people might not believe, like someone's gonna kill you, someone's following you?
None. I am Nitya, 45 years old.
Release. Can you spell the word carne backwards?
ENRAK.
Can you tell me your name?
I am Nitya,
Can you tell me what time of the day it is?
1 o'clock p.m.
Can you tell me where we are?
At your clinic.
Do you have any problems with your memory? Can we try it out?
Okay.
Can you repeat mango table coin?
Mango, coin, table.
What did you have for breakfast?
Spam with rice.
Can you tell me any recent news that have you watched?
President Bongbong Marcos.
Can you subtract 7 from 100 and do it 5 times?
193, 86, 79, 72.
Do you have any plans after this interview?
I will watch TV.
So for this test, I would like you to close your eyes and then I will let you smell something. You will tell me if you can smell it and what it is. Okay? So can you please close your eyes? Can you smell this?
Yes.
What is it?
Coffee.
How about this?
Coffee.
Okay, thank you. So for this test, I will cover one of your eyes and then you will read the smallest line that you can read, okay? So for this one,
428736.
okay. The other one,
428736.
okay, very good. So for this test, I will ask you to cover one of your eyes and then you will have to focus your gaze on my nose. And then I will show you some numbers with my hand and then you will tell me what they are, okay? So please cover one of your eyes. Focus your gaze on my nose. Okay? So what number is this?
4, 2, 1.
Okay? The other one? What number is this?
4, 5, 2.
Okay, thank you. So for this test, without moving your head, you have to follow this object with your eyes. And then I will move it to different angles. And then you will tell me throughout the process if you have double vision, okay?
Okay.
Okay, so please follow this. Okay, thank you. So for this next test, I will close the light so that it will be dim here. And then I will shine this pen light in one of your eyes and then see for pupillary reflex, okay?
Okay.
Okay. So first, okay, thank you. So for this test, I'm going to show you my left index finger. You will focus on this, but when I show you my right finger, you will have to shift your focus from my left finger to my right finger as fast as you can, okay?
Okay.
So let's do it. So my left finger first, focus on my left finger and then right. Again, left and then right. Okay, thank you. So for this testing of light touch, I will take this cotton wool and touch your face with it, and then you will say yes if you feel the touch, okay? So before that, can you feel this? Can you feel this?
Yes.
Okay, so please close your eyes. Say
Yes.
yes. Okay.
Yes. 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 Yes.
Okay. So for these next tests, I will give you some commands and you need to listen attentively and follow them, okay?
Okay.
So for this test, please clench your teeth. I will check for your muscles. Okay. Now can you please open your mouth? I will put my hand here and then I will try to close your mouth, but you have to resist it, okay? Okay, good. So for this next test, you will tell me if you feel a sharp pain, you say sharp, or a dull pain, you say dull. Okay? So please close your eyes. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp. Okay. So for this next tests, you will need to follow more commands, okay? So can you please shut your eyes tightly and I will try to open them, but you will not let me open them, okay? So please do it tightly. Okay, good. Now you will look at the ceiling as you wrinkle your forehead. Okay? Okay, thank you. Please show me your teeth. Okay. Blow out your cheeks, please. Okay. And then lastly, please wrinkle your neck muscles. So you do this. Okay, thank you. So for this next test, I will tap this on my knees and then I will put it in here. You will tell me if you hear a sound. You will say yes. And then after that, you will tell me when the sound stops. And then I will ask you again if you hear the sound. Okay? So let's do it now. Can you hear the sound?
Yes.
Tell me when it stops.
It stops.
Can you hear it now?
Yes.
Okay. For the other side. Can you hear the sound?
Yes.
Tell me when it stops.
Stop.
Can you hear it now?
Yes.
Okay.
Can you please say ah?
Okay. So for this test, I would like you to open your mouth and say ah, and I will examine your mouth. Okay? Okay. Show your shoulders. Okay, good. Then for the next test, you will turn your head to this side, and then you will push your head against my hand for resistance. Okay. Okay, for the other side. Okay. Okay, good. So for this next test, I will ask you to please stick out your tongue. And then, okay, good. Wiggle them side to side. Okay, good.
I'll need you to stand up and walk down the hallway on your normal walk. After which you walk on your heels like this. Then back to this position on your toe like this. Okay? So can you please stand? Okay, can you walk down? Okay, back here. Good. I need you to walk on your heels. Okay, and your toes. Good. Okay. Mr. B. Now I'm going to assess for your muscle tone. All I need you to do is to relax. I'm going to be the one to do all the work, okay?
Okay.
Okay. Okay. Okay. So very good, Mr. B. Now we are going to assess your muscle strength, okay? I need you to raise your shoulder up, flex your elbow. I'm going to try pulling down your shoulder, try to resist me. Don't allow me to pull it down, okay? Afterwards, I'm going to try to raise it up. Pull your elbow down and don't allow me to raise it up, okay? So that's for this. Going to the next, I need you to keep your elbow flexed like this. I will try to pull back your arm, resist the force, okay? Afterward, I will repeat here. Try to resist my force, okay? So now onto the action. Can you raise your elbow? Okay. 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 So Mr. B, now going on to the next, I will need you to raise your arms, then face it downward. Then if I ask you to close your eyes, you close your eyes, letting your arms be steady as you raise them, okay?
Yes.
Okay, so under the text, can you raise your hands? Okay, can you turn them? Okay, close your eyes for me. Okay. Okay, Mr. B, so for this test, I'm going to use this equipment and slightly hit your knee. So don't worry, I'm not going to hurt you, okay?
Okay.
Okay, so this is not.
So sir, I'm going to test your sensory. So
Okay.
I'm going to let you feel a light touch, vibration, pain. So first, can you feel this?
Yes.
Okay, now I need you to close your eyes and then tell me if you feel it.
Yes. 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 Yes.
I'll move on to your other arm.
Yes. 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 Yes.
Okay, down at your foot.
Yes. 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 Yes.
Next.
Yes. 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 Yes.
Okay. Now next test is the vibration. So I'm going to let you feel a slight vibration and tell me if you can feel this. Can you close your eyes again? Can you feel
Yes.
this? How about here?
Yes. Yes.
Here? This one?
Yes.
Here.
Yes. Yes.
At your foot?
Yes. Yes.
Okay. So next, you're gonna feel a slight pain. Can you feel this?
Yes, no.
So can you close your eyes?
Yes. 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 Yes.
Next.
Yes. 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 Yes.
How about here?
Yes. 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 Yes.
The other foot?
Yes. 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 Yes.
So can you turn your palm up and then close your eyes. Tell me what number I will write on your palm.
7, 2, 6,
Okay. For your other arm, hand.
7, 3, 6.
Okay. Okay. So for your Romberg's test, you have to stand still with your feet together for at least 30 seconds. So for the next part, you have to close your eyes and try to stand still for 30 to 60 seconds with your feet together.
Okay.
So can you close your eyes?
The cremasteric reflex is a reflex in human males. It is dependent upon the nerve roots L1 and L2. This reflex is elicited by slightly stroking the superior and medial part of the thigh in a downward direction. The normal response is a contraction of the cremaster muscle that pulls up the scrotum and testes on the side stroke. Upper and lower motor neuron disorders can cause an absence of the cremasteric reflex. Bulbocavernosus reflex refers to anal sphincter contraction in response to squeezing the glans penis or tugging on the fole. Reflex involves S1, S2, and S3 nerve roots and is a spinal cord-mediated reflex arc. Following spinal cord trauma, presence or absence of this reflex carries prognostic significance. In cases of cervical or thoracic cord injury, absence of this reflex documents continuation of spinal shock or spinal injury at the level of the reflex arc itself. The anal wink, anal reflex, perianal reflex, or aneocutaneous reflex is the reflexive contraction of the external anal sphincter upon stroking of the skin around the anus. A noxious or tactile stimulus will cause a wink contraction of the anal sphincter muscles and also flexion. The stimulus is detected by the nociceptors in the perianal skin to the pudendal nerve, where a response is integrated by the spinal cord sacral segments S2 to S4.
So, we would be testing your coordination, gait, and balance, and it would involve watching you walk and testing the coordination of your arms and legs. Now, let's start by you walking towards the other side of the wall in a straight line. Okay, good. Now turn over, and then can you please walk heel to toe and continue walking in a straight line. Okay, that's good. Turn over again. And can I ask you to walk on your heels and in a straight line? Okay, good. So now we would test for your coordination. So may I ask you to take your index finger, touch your nose, and touch my finger pointing at you. Touch your nose again, and keep following finger. Okay, last one. Good. Now let's try it with your left arm. Okay, just do it again. Touch your nose and follow this. Okay, last one. Okay, good. So now I would like to ask you to do some rapid alternating movements. So can I have your right hand? Place it on top of your left hand like this. Turn it over and do this as rapid as you can. Okay, that's good. Now can you do it on your left arm? And do this. Okay, that's good. Thank you. Okay, now let's assess your speech. I would like to ask you to repeat for me a few words. Is that okay with you?
No problem, doctor.
Okay, so for the first word, can you say Philippines?
Philippines.
For the second word, can you say wonderful?
Wonderful.
Now for this test, I would like you to follow my finger with your eyes, but keep your head as steady as possible. Okay? Keep your head as steady as possible. Okay, good. Keep your head steady. Okay, good. Thank you. Now let's test for your balance. May I ask you to put your feet together like this and put your arms forward. I will put my arms in front of you for support. Now I will ask you to close your eyes. And in 5 seconds, I will ask you to open it again. Okay, good. You can open it now. Okay, now may I ask you again to put your arms straight like this. And can you please close your eyes? And I would be putting pressure on each of your arms. And as I try to put your arm down, try your best to bring it back up into its original position. Okay, we'll start now. Okay, good. Next, can I have you touch your right heel on your left shin and then slide it down until the top of your foot. Yes, slide it down. Alright, can you repeat it one last time? Okay, that's good. And can you try the other leg? Slide it down to the top of your foot. Okay, repeat it one last time. Thank you. So thank you very much for your participation. That would be all for our survey.
I want you to walk on your heels and then next walk on your toes, okay? So for the heel part, you need to walk like this. And then for the toes, you need to walk like this. Okay?
Okay.
In a straight line. Okay. Then on your toes. Okay, good. For this other test, I want you to walk across the room in a straight line in tandem. So, do a tandem walk. So, it's like this. 1, 2, 3, 4, until you reach the edge. Okay? Can you do it, please? Okay. So for this test, I want you to know to walk across the room normally in a straight line. Okay. So for this test, I will need you to stand straight. You need to hold your hand up with your palms forward. And then you keep that position while closing your eyes for 20 seconds. Even if I tap your hand, you need to keep that position, okay?
Okay.
So please close your eyes. Okay. So for this next test, I will ask you to keep your feet close to each other. You need to stand straight and then you need to stay still and close your eyes for 30 to 60 seconds. Don't worry, I will support you, okay? So please close your eyes.
Hello, mister. Can you just relax your body and then let my skin is relax. Don't do any resistance. I will lift it. Do you feel any pain?